As COVID-19 cases continue to rise in Maryland, hospitals across the state are gearing up for potential influx of virus patients. WMAR 2 News' Ray Strickland spoke with medical professionals in our area about how they're hoping for the best but preparing for the worst.
Hospitals here in Maryland have prepared for a fall surge for months. The doctors I spoke to say they have everything they need right now to care for patients, but there is a concern about a wave that's worse than they predicted. Hospitals across the state are hoping months of work in putting together surge plans will be enough to fight off the virus that is once again ramping up across the country.
So a lot of the preparations are in regards to what accommodations can we make into the hospital to allow more room for the sickest patients.
Dr. PANAGIS GALIATSATOS is a critical care physician at Johns Hopkins Hospital. He says the hospital has been stockpiling supplies such as PPE and other resources. They use the first wave of COVID-19 cases as a lesson to get ahead of the fall surge.
We are adequately prepared to handle a large volume of patients.
In Maryland, more than 1,700 people tested positive for COVID-19 on Wednesday, making it the 8th straight day the state reported more than 1,000 cases. Hospitalizations also topped 800, reaching levels not seen since mid-June.
It's easy to serve when things are easy. This is the part that's not so easy.
Dr. Thomas Scalia works as the physician-in-chief at the University of Maryland Shock Trauma in Baltimore. He says the hospital has been preparing for a number of scenarios and is ready for the challenge, but he worries about the surge being much worse than they predicted.
My biggest concern is the uncertainty. Just not knowing what's going to happen.
Bob Atlas, who is the president of the Maryland Hospital Association, says the convention center, which now serves as a field hospital in Baltimore and reopened hospitals in Tacoma Park and Laurel, will be able to help with the high volume of patients. But he notes a critical factor moving forward is dealing with the nationwide shortage of nurses.
Manufacture them on an assembly line, and we need everybody to be available.
But as we continue to battle the virus, Dr. GALIATSATOS is urging Marylanders to stay vigilant to control the spread.
You are all the front line. Help us by helping yourselves.
And that means staying on top of hand washing, social distancing, and wearing a mask, which experts say is a vital weapon against the coronavirus. Reporting in Baltimore, Ray Strickland, WMAR 2 News.